The tenolok dual expanding tenodesis anchor allows for a fast, easy, and reproducible technique. To begin a subpectoralis biceps tenodesis procedure, arthroscopically release the long head of the biceps at its insertion point on the superior labrum. Make a 3 cm incision centered over the palpable inferior border of the pec major muscle belly. Then dissect through the skin and fascia to the pec major tendon insertion on the humerus. With proximal retraction of the pec major, the long head of the biceps tendon will be located just medial to the pec major insertion. Next, place a drill tip guide pin centered within the bicipital groove, 20 mm from the inferior border of the pec major tendon insertion. An 8 mm badger drill bit is placed over the guide pin and then drilled 20 mm or unicortically to create a socket. Measure and mark the tendon 20 mm from the musculotendinous junction or the created socket. Then pass the biceps tendon through the hyphae suture loop at the leading edge of the tenolok implant. Align to the 20 mm marking and then tension and cleat the suture to secure the tendon to the implant. Orient the biceps tendon so that it exits the bone inferiorly toward its distal insertion point. Insert the implant while maintaining the same angle of approach used during drilling. Then, deliver the implant and tendon construct into the socket with light malleting until the laser line is flush with the humeral cortex. While holding the delivery handle firmly, turn the knob clockwise to deploy the tenolok anchor. An audible pop sound signals the implant has fully deployed. Note that the tenolok offers dual fixation, expanding both cortically and subcortically for secure repair. Next, disengage the driver from the implant. Loosen the cleated sutures and remove the driver. Now cut the excess tendon. Multiple half hitches can be tied. Then cut the remaining suture. The final construct shows the biceps tendon implanted into the humerus and on both sides of the tenolok dual expanding tenodesis anchor.